COPD is both preventable and treatable. It is due to abnormal inflammatory responses. The pulmonary diseases are typically progressive, and what that means is that they tend to get worse over time. But people can be stabilized and they can live a very long time with lung diseases. The number one risk factor for COPD, especially for chronic bronchitis and emphysema, is tobacco smoke. So even though people may, obviously lung cancer is a risk as well, but a lot of people who smoke will have COPD. And also secondhand smoke. So a person may not need to be the primary smoker. There are definitely people who have COPD as a result of secondhand smoke. And there are people that are exposed to other noxious particles, gases, ozone, lots of pollution, people who live in high pollution areas. So that can also give people COPD. People who have COPD have lots of coughs, and they have lots of sputum production, mucus, and they're often short of breath. Severely short of breath, not just the normal shortness of breath that might occur with exercise. So smokers' coughs, if you know people who smoke, even if they're young and they're developing a smoker's cough, they might be on their way to getting COPD. So what typically happens with people who have at least moderate COPD? They've been diagnosed through the pulmonary function test, through the graded exercise test. They're normally going to take bronchodilators, so they're going to have a lot of medications that are going to help open up their airways. The main problem with people with COPD is that the air stays trapped in the lungs. They have difficulty getting their air out. So that's why they're going to use bronchodilators. People who have severe COPD, and I'm sure you've seen a lot of people who may be on supplemental oxygen, they may do inspiratory muscle training and, trying to use devices to do that. And you can see with the gentleman in the photo, he's doing what's called pursed lip breathing, where that's going to improve his inspiratory muscles and allow him to get more air out of his lungs. Interval training. So it's exactly the opposite of what you think might happen with exercise. In working with brief high intensity and then alternating with low intensity, that actually does help improve their function just a little bit. And resistance training, particularly focusing on the extremities, because the better your muscle strength and your muscle endurance in your extremities, then that's going to take a little bit off the lungs. The lungs are typically not going to limit people's ability to exercise, and it's not going to limit your VO2 max unless you have some sort of lung disease. It's usually your cardiac output that's going to limit your VO2 max, your heart rate and your stroke volume, and not typically your lungs. Here are the spirometry functions. These are out of the ACSM guidelines book. So looking at the numbers for COPD, you can see that they have, much lower function of their FEV1, less than 50%, and looking at very severe, so less than 30%. So, these are low values, and people would be diagnosed with pulmonary disease, and they would also have symptoms.